Hi, my name is Sexton, and today I'm going to be demonstrating inserting a Foley catheter on a female. I'll be sure to follow all GPSP during this procedure. So first, I'm going to knock. Hi, my name is Kennedy. I'll be your nurse today. Can you tell me your name and date of birth? And the name and date of birth matches the wristband. And do you have any allergies I need to know about? They don't have any allergies, so at this point I would raise my bed to a good working height. I would provide for privacy for my patient, and I would help them get into this position if they needed any help. And I would also perform any focus assessments needed on the perineal area or the abdomen, anything I need to know before putting this catheter in. And at this time I could also educate my patient on what we're going to be doing and what they need to expect. First I'm going to perform hand hygiene. I'm going to place a check pad, and we're going to perform pericare first. Okay, I've got a clean washcloth with warm water and soap. Clean outer top to bottom. Once again, outer top to bottom. In the middle, outer top to bottom. Put that in the laundry. And then I've got another clean washcloth here. Outer top to bottom. Outer top to bottom, and then middle top to bottom. Put that in the laundry. I'm going to dispose of this check pad, and we're going to lay a new one down for placing the catheter. Alright, now that that's all set up, I'm going to perform hand hygiene, and now I'm going to set up my sterile kit. It is within the expiration date. It's clean and dry. There's no tears or rips or anything like that. Making sure just to touch the 1-inch border. Once again, just making sure to touch that 1-inch border. Okay, now that we have that all set up, I'm going to perform hand hygiene once again. And I'm going to don my sterile gloves. Once again, just making sure to touch that 1-inch border only. So first I'm going to don my dominant hand. Now that we have our sterile gloves on,
actually awesome. Thank you, Dave.
okay, now we're going to place our catheter into the loop.
Yeah, I'm going through it right now. Wraps and or
Okay, now that we're all ready, I am going to displace tissue, rest my non-dominant hand on that pelvic bone, exposing the urinary meatus, and I have identified it. So now we're going to clean. I'm going to take a clean swab, and I'm going outer, top to bottom. Once again, outer, top to bottom. And then inner, top to bottom. Okay, now that we're all clean, we're going to place the catheter. I'm going to take it out of the loop. I'm going to find that urinary meatus, and I'm going to advance it straight into there, making sure not to touch the labia. And we're going to advance until we get urine output. And once we get urine output, we're going to go 2 to 3 more inches. Okay, now I'm going to take my non-dominant hand and hold that catheter. I'm going to inflate my balloon per ordered. Move my syringe. give that a tug. Everything looks good. And I'm going to make sure my catheter is firmly placed. And now I'm going to make sure there's no kinks in my lining or my tubing, and I'm going to hang this on the bed frame, a place where it's not going to be moved and it's going to stay below the bladder. Okay, now we can clean up our mess. And I would take my gloves off, perform hand hygiene, assess my patient once more, and then I would report and record my procedure immediately.